probably on everyone's mind is the boil water order, and I think that Bill Goss will be addressing that, and I don't want
Okay. Okay. Again, my name is Bill Goss. I'm an engineer. I work with the Oregon Health Authority Drinking Water Program out of Pendleton. First, I'd like to talk a little bit about the cause of the Cryptosporidium outbreak. At this time, the investigation is still ongoing. The exact source of the contamination that made people in Baker City sick and prompted the boil water advisory has not been identified for certain yet. There's been Cryptosporidium detections at multiple sources up in the watershed. But Cryptosporidium is usually found in fecal matter of animals. And we understand the boil notice is extremely disruptive and inconvenient for the whole community. But as the Oregon Health Authority, our primary concern is to protect the public's health. And that's why the boil order is in place, is to try and keep anyone else from getting sick. I'd also like to say that really no one is to be blamed for this event. It's kind of a naturally occurring event. This parasite is carried by animals. There's animal droppings on the ground up in the watershed. Precipitation can wash that into the streams and into the city's intakes, and it made its way into town. So I can't say I can blame any person for this event. Nor can I say anyone can quickly resolve this situation. It's going to take a bit of time to really figure out exactly what happened and how to resolve it. There are multiple state and local agencies working together to keep the residents informed and to protect your health. Now, I'm sure a lot of people have been asking how and when the boil water notice can be lifted. It is our agency's decision, the Oregon Health Authority Drinking Water Services decision, to determine when the boil advisory can be lifted to ensure that public health is protected. We've worked to establish some criteria on when the boil order can be lifted, and what we'll be looking for are more sample results from the water, and we would need 2 consecutive samples from each of the drainage intakes that are in use, and also 2 consecutive samples that show no oocysts from 3 locations in the distribution system. So we're looking for water with 0 detections of Cryptosporidium in it. Now, why would we be looking for 0 detections in the water? Because of the outbreak, 0 detections of the Cryptosporidium is necessary to ensure this contamination event has passed and that the public's health is protected. We want to use the most conservative number, and there is no value for ensuring contamination is no longer in the system other than 0. Once we are able to lift the boil advisory, the Oregon Health Authority will develop an ongoing monitoring plan with the city. Trace counts of Cryptosporidium cysts may be allowed because such small numbers, single-digit numbers, are not thought to cause illness. Discussions with the city will continue as results become available, so we're going to be in close communication with the city staff during this whole process. As far as the long-term protection from Cryptosporidium exposure, the city is required to install treatment for Cryptosporidium by October 2016, and we understand it is on track to comply with that deadline. Treatment could consist of ultraviolet light as the plan that's in place now, or else filtration of the water. Those treatment methods either remove or inactivate more than 99.9% of Cryptosporidium cysts. So after that treatment system is in place, will the water be completely safe? Well, as I said, the system is designed to inactivate or remove more than 99.9% of the cysts, but that does not completely eliminate the risk of exposure or other contaminants in the tap water. That does meet the treatment standard that is required by the federal rules in the Safe Drinking Water Act. The Public Health Division is working with the city to develop a plan for regularly monitoring Cryptosporidium levels in the water to better understand the risk and communicate that to the community so residents can take steps to reduce their risk if deemed appropriate. So some of you might want to know how to make your own water safe right now from Cryptosporidium. The city's plant for ultraviolet light or filtration, as I said, will remove or inactivate more than 99.9% of Cryptosporidium cysts, but there is no way to completely eliminate the risk of exposure to this parasite. However, it is possible to dramatically reduce Cryptosporidium concentrations in drinking water using one of those methods. Residents who are at risk for serious complications from Cryptosporidium, including immunocompromised individuals, infants, and the elderly, should consult with their doctor. Boiling is the only way to kill all Cryptosporidium cysts in water.